So the Renuvion J Plasma is a device that's used to tighten the skin. Typically, it's used in conjunction with liposuction. Great areas to do are kind of lower face, upper neck, and chin area, and that's probably my favorite area to do with the Renuvion. It's mostly for patients who have some neck laxity, not extreme amounts of neck laxity, a little bit of fat deposition under the chin, and who don't want to do a facelift or a neck lift and who aren't quite ready to do that. I would say it takes about 5 to 10 years off the laxity of the neck and lower face, and kind of helps to pull kind of the marionette folds back as well, and the upper neck back. I would say it's minimally invasive. There are small incisions that are made about 1 centimeter under the chin, and then about 1 centimeter around each ear. A little probe is put in after we have numbed the neck and the lower face fully. A little probe is put in to lift the skin up, and then we do a little bit of liposuction under the chin, and then we use this device called the J Plasma. It looks like a little lightning beam when it emits its energy. And there's minimal heat deposition, so I have my hand right on the surface of the skin as it's running underneath the skin, and it's tightening the skin. You can actually feel it tighten the skin as you're doing it. And it really, you have about, I would say about 1 to 2 weeks where you do have that swelling. And you do have to wear a compression garment for the first week fully when you're at home all the time. But there's minimal incisions, less risk of nerve damage than when you're doing a facelift because you're not doing a lot of cutting. And for people who don't want to do general anesthesia or have a fear of it, I think that that's really helpful because you're not put to sleep. We just do what's called tumescent anesthesia, where we fill the lower face and the neck with a dilute solution of lidocaine. And you're just a little sedated. We give you a little Valium, a little Percocet before you come in, and you can take a little solution of Versed, which will just make you sleepy. And you are, again, not under anesthesia. So you are very comfortable. Patients are not in pain. They often fall asleep while we're doing it. It takes us about 2 hours to do it. And it, again, is just a procedure that really will give you kind of a partial neck lift. So not fully a facelift. I'd say it gives you about 75% of the results of a neck lift, but not going under general anesthesia, not cutting all those nerves.